In this example, the immunoassay involves an unlabeled antibody. So there are no radioactive or fluorescent molecules attached to it. When the antibody binds the antigen, this forms a complex which changes how light is absorbed when the sample is put in a spectrophotometer. So, one can determine whether or not a specific antigen is present in, say, a patient's blood serum, because it would then vary in its transmittance of light if it is present compared to serum where it is absent. Also, if one can then determine what is the average level of say, a serum protein, then one can get the average transmittance to expect and be able to identify patients who are making more serum protein than expected, in which case more light is absorbed and less is transmitted, versus patients who are producing less of this serum protein, allowing more than the normal amount of light to be transmitted. So this assay would not only allow the detection of a specific, in this example, serum protein when it is present, but then also a measure of the amount of this serum protein so that one could quantify it and compare it to standard values.